Should we be satisfied with the status quo, or can America do better? I think that's a fundamental question. If we do some reform, how is it proposed to be paid for? About 40% of this, basically these pies over here, are trying to weed out waste, fraud, and abuse in the system. And about 56% would be in a high-income earner surcharge for income tax for those over in the top 1%. So let's talk people who receive health care from your employer. You're happy with your current coverage. Probably most people in the room today are in this category. What it'll mean? It'll mean you can continue your insurance coverage. You want to keep your plan, keep your plan. Nothing will change. Will reform give taxpayer-paid health care to illegal immigrants? The answer to that is no. The bill is very, very specific that people that are not documented adequately in the country will not receive benefits in the bill. It is made very, very clear. I don't think it's surprising that there would be misinformation floating around about something that is as complicated as this. Will the healthcare exchange be private health insurance plans under government control? No, with this caveat, what this bill will do, it basically will say that you do have to be in a plan that does meet some minimum requirements. So it does require us to have certain level of protection that we all will be in the same boat on, at least that level of protection. I think it makes sense to have a public option in this plan for 2 or 3 reasons. Number one, it is a very, very meaningful way to provide some competition to the private insurance industry. It seems to me that if we're going to effectively mandate people to have private insurance or have insurance, we have to give them some option to know you're going to have a system that is not gerrymandered just for profit. So to me it makes sense. Now there's an important point on this public option as it is currently situated. There has been a very, very important critique of public options. The people who are opposed to the bill suggested that somehow it would be an unfair competitive situation. Well, we fixed that problem because we made it very clear that the public option in the bill will have to be supported only by the premiums it receives from the people who opt into the public option. It will not get a subsidy by the general fund of the taxpayers of the United States. This is a very important point. We've made it clear that that's fixed. I can tell you, I've looked at this bill, I've read it tooth and nail, and I just don't think you can find something that's going to end up with a government bureaucrat deciding what health care Americans get. I've looked at the bill. I don't see anything in the bill that scares me. I relish a good debate. It's healthy, it's honest, it's frequently productive. But I have to tell you, I do not relish people trying to scare people. I really don't. In a status quo, when people ask, how are we going to afford to do something? My view is I don't think we can afford not to do something. I don't think we can afford not to do something. I don't think we can afford not to do something.
Why the Democratic Party isn't really standing up to some of the fear-mongering that's going on.
It's clear you are not getting our letters or you are not reading our letters. The form letter that we get back from you are not even addressing the topic that we wrote you about. If you cannot support each piece of legislation with a specific article of the Constitution, you have no business even considering it. Nowhere in the United States Constitution does it allow for the federal government to create a business to compete with a private industry, in this case, the health insurance.
Right now, Medicare provides health care for about 15% of Americans. And the VA system is a government-run health care. Do you think those three programs are violative of the Constitution, in your view?
The Veterans Administration is an arm of the military, and I think the government, in the Constitution says that the federal government can provide an Army and a Navy. So I think that one is fine. I don't know about Medicare and Medicaid. If it's unconstitutional, I don't know. I know that this bill that's being proposed right now is a huge takeover of a sixth of our economy. I do not think it's constitutional to do it. I think it's too much money, and the government is not a business. It never makes a profit. It never makes me money. It only takes my money.
I will make sure Medicare is not unconstitutional. I don't believe it is. I'll make sure it's not, and I won't do anything that is unconstitutional. I will follow that oath. I will give you that pledge. I practice law, so I've had some experience with these matters. I will make sure Medicare is not unconstitutional. I don't believe it is. I've had some experience with these matters.
And the reality is, every other Western democracy has long since decided that a government-sanctioned, run, organized, and supervised program is the way to go. The government is the way to go. You are the government. We the people. You don't have the government.
I'm just curious that you see no downside to a federal system that enables the administration, not the Congress, to have personal information on every American citizen with no due process.
That does not offend my concept of privacy. You know, that's the question I can't give a yes or no to. The reason is mom and dad always told me to tell the truth. There's no truth in this, because I don't really answer that. I try not to be ideological. I try to be a person who tries to get things improved for my neighbors and people I represent. That you identify is one that I'm not sure there's a black or white answer to. It's a matter of personal view. I'm just sure how you phrase it.
Give us time to review the final rule.
Actually, I don't have control of that because I'm not speaking to the House of Representatives. I listen to talk radio. I listen to talk shows, you know. And I hear some of these people talking about there, and I go, what planet are they living on?